Hi friends, good evening. This is Dr. Sheetal Agarwal. I'm a senior consultant gynecologist obstetrician practicing in New Delhi, India with Apollo Group of Hospitals, Apollo Cradle, Royal, Nehru Place. Today I'm going to discuss a very important and a very common topic regarding irregular periods in a female. Why irregular periods happen? What are the causes? So in brief I'll discuss. Now, to discuss irregular periods in a female, I'm going to divide the menstrual life of a female into three phases. The phase when her periods start, her reproductive phase, and her menopausal phase. So, the phase when her periods start in a female is called menarche. The periods during menarche are generally very irregular periods because they are anovulatory periods, meaning the ovary is not releasing eggs, and these periods are a breakthrough bleeding in the uterus because of which a female is menstruating, and these periods are generally irregular. Normally a mother comes to me, she tells me, doctor, my girl started menstruating and now it has been almost 3-4 months and she has not had any periods. So it is not a cause of concern. We just counsel the mother, we just counsel the young female, young lady, and we tell them that over a period of time when the ovaries starts ovulating, the cycle will become regular. So generally these type of irregular periods which happen at the beginning of the menarche when a lady just starts menstruating, they don't require any treatment. So if a doctor tells you that this female has to be put on hormones, it is complete no. At this age, at a young age of 10, 11, 12, no hormonal therapy is required. Nothing is required. Just good nutrition, good counseling, good diet is given to the girl. And normally in a span of 3 to 4 years, her periods become regular. Then we come to the reproductive age of the young girl. During the reproductive period, why her periods become irregular? What is the cause of irregular periods during the reproductive age group? So here I'm going to tell you the physiological causes and the pathological causes. Normally, any type of stress, especially in this time during pandemic, we are going through lots of emotional turmoil, lots of stress. There is loss of life, loss of our near and dear ones, financial loss is there, loss of job is there. All this stress can create havoc in our mind and we can have irregular periods. So this stress is a very important. When a patient comes and doctor, like I don't have any periods for 3-4 months, I am not sexually active, so what could be the cause? Then we have to actually counsel them and tell them that this stress is the main cause which is eating you, which is playing havoc with your periods. Second physiological cause of having irregular periods is when you suddenly lose weight. Like in a span of 1 month, 1.5 months, if a female loses 10-15 kgs, her periods will stop completely. She'll become amenorrheic. So always we advise our patients that whenever you are on want to lose your weight, see to it that it is a gradual loss of weight. See about 2 to 3 kgs in a month. Never lose drastically 10-15 kgs in a month. Your periods will stop. Also, when you gain that much weight in a month, that can also cause your loss of periods. So you have to be very careful when you are losing weight or gaining weight, because this can again create havoc with your menstrual cycle. Third important cause which I see in reproductive age group of irregular periods is PCOD or Polycystic Ovaries. Friends, I have seen at least 6 patients out of 10 coming to my OPD with PCOD. So what are the main symptoms of polycystic ovaries? The main symptom is irregular periods. The lady will say that she menstruates in 1.5 to 2.5 months for say 5-6 days, and again she doesn't see her periods for another 1.5 to 2.5 months. Other symptoms of polycystic ovaries are that she will develop acne on her face, she will have hirsutism, she will be obese, there can be pigmentation, particularly the pigmentation at the nape of the neck, which we call acanthosis nigricans. And another important symptom of PCOD is infertility. Patient may not know that she is having PCOD and she may just come to us that she is not being able to conceive, and on investigation we find out that she is having PCOD. Now, how do we manage PCOD? If I tell you in brief, PCOD, there are 2 types of management, medical and surgical. First, we diagnose PCOD, we get her ultrasound done, we do her hormonal test done. On day 2 of the periods, we go for LH, FSH levels. we do serum prolactin levels, we go for other testosterone, other levels, and along with ultrasound, we come to a diagnosis that this patient is having PCOD. So if it is young patient, unmarried, who is not keen to have children, we put her on medical management of pills, estrogen progesterone combination pills, and if she is having insulin resistance, she may be put on the medicines to control her insulin resistance. But if the female comes to me with infertility along with PCOD, then my management is not medical management. Then I take her up for surgical management. I do her laparoscopy, do ovarian drilling, remove all the cysts, drill all the cysts, remove the cysts from her ovary so that she starts ovulating and then she can conceive. So PCOD is another very common cause of irregular periods during reproductive age group. Other common cause of irregular periods in reproductive age group is thyroid problems, hypothyroidism, very common. If my patient comes and tells me, doc, my periods have become very irregular, I am gaining weight, my skin is becoming rough, dry, immediately it strikes my mind she may be having hypothyroid. I get her TSH levels done, and if my diagnosis proves to be correct, I start her on thyroid medicines, and believe me, in a span of 3 to 6 months, once her thyroid levels come down, the period problem, in fact, it just disappears completely. So you have to be very quick in the history tells us, the history of the patient tells us what could be the problem in this patient. Other important reason of irregular periods in reproductive age groups are polyps, particularly the cervical polyps. That means the polyps at the mouth of the uterus. Now these polyps will off and on they will bleed. A lady will say that she has her regular cycle, and then after 1 week or so again she sees blood. And this bleeding will stop in 1 or 2 days, then again after some days she sees the blood. This is a fresh blood. This is a typical history of cervical polyp. So if we do local examination, per speculum examination, we can see a polyp hanging from the cervix. There could be an intrauterine polyp also. Again, the management is very simple. We just do hysteroscopic. We take the patient after routine investigation. We take the patient to the operation theatre. We do hysteroscopic polypectomy. That means we put the laser inside the uterus. We put a hysteroscope inside the uterus, and we remove the polyp from the base, cauterize the bleeding area, and the symptoms are completely cured. So these are certain things which can be cured completely. Now coming to other causes of irregular periods in this age group, she can have cyst. She can have a simple cyst. That means the ovary has formed a cyst. The egg which was supposed to be released from the ovary did not release, and it developed into a cyst. Now any cyst less than 5 centimeters does not merit any surgery. We just treat it by medical management. She can be put on hormones, she can be put on antibiotics, and normally in a cycle, in 2 to 3 cycles, the simple cyst disappears. But any cyst more than 5 centimeters, it has to be evaluated completely. We have to do her MRI, we have to do her tumor markers, we have to rule out malignancy. Any cyst more than 5 centimeters will require surgical intervention. Simple cyst, we just do laparoscopy and remove it. But if her tumor markers are high and our MRI is suspicious of any malignancy, then guys, a radical management is mandatory. Like we have to do some radical intervention, some surgical intervention to see if it is a cancer, then it has to be cured completely. So then it could be fibroid. Another causes of irregular period is when she has fibroids, especially the intramural fibroids. The patient will typically come with the history that, doctor, I bleed for 8 to 10 days in a month. Then another 20 days later, I again start bleeding. I have very heavy bleeding. I pass clots. So this gives me an idea if she is having heavy bleeding with passage of clots, she could be having fibroids. So again, we do an ultrasound. Mind you, everything that patient is very intelligent. You have to listen to the patient. You have to listen thoroughly to what she is saying. And the history gives us, it clicks a diagnosis within our mind. So if she's giving a history of heavy periods with passage of clots, we get an ultrasound done. Normally a diagnosis of fibroid is made on that. So if she wants to have children, we try to preserve the uterus. We go for laparoscopic myomectomy, wherein we put the laparoscope and remove the fibroid. Or if the fibroid is on the inside of the uterus, we go for hysteroscopic myomectomy and remove the fibroid from there. So again, a main endeavor is to preserve the uterus at any cost. Get rid of the problem and preserve the uterus so that the fertility of the patient is preserved. Then another cause of irregular period could be endometriosis, wherein the cycle may not be that much irregular, but it is a very painful cycle. She says that, doctor, earlier my periods were okay, but for the past few months I'm having very painful bleeding. While I become intimate with my partner, it is unbearable pain. She may be having pressure symptoms that while passing motion she is very pain. Now these all symptoms of the patient clicks a diagnosis of endometriosis. Again we do a scan. If it is an endometriotic cyst, we do the laparoscopy, remove the cyst, and thereby treat the patient of her symptoms. So this is the second reproductive phase. Now coming to the irregular periods in the menopause, during the menopause and the perimenopausal age group. Now here I would like to tell you that during menopause, when the patient approaches menopause, the cycles become long. That means the duration of the cycle, it may not come every month, it may come 1.5 to 2 months, and the flow decreases. If she was earlier bleeding for 1 week, now she will bleed for 3-4 days, 2 days. The flow is very less. So this is a normal menopause. A lady is approaching towards menopause. Her duration of the cycle has increased and her flow has decreased. The duration of the periods has decreased. The flow has decreased. That is not natural menopause. We tell the patient nothing to worry. But then now if the patient tells me in a perimenopausal age group, doctor, I'm almost bleeding daily, I feel that my periods are over, and again after a few days I start bleeding, it seems as if my periods are not stopping, that is really a cause of concern. Like, you just cannot ignore these symptoms. We do an internal examination, we rule out polyp, and then we do an ultrasound. See, in ultrasound, apart from seeing for any cyst, fibroid, during menopause and perimenopausal age, the endometrial thickness is very important to see the endometrial thickness. And if that endometrial thickness is more than 10 mm, even after 10 days of bleeding, that is a cause of concern. We immediately prepare the patient for DNC hysteroscopy, wherein a hysteroscope is put inside the uterus. We take the curettings, send for histopath examination. If it is a simple endometrial hyperplasia, it can be treated by medicines, by progesterone support, we can put Mirena. But if it is something more than that, it can be adenocarcinoma or cancer endometrium. Then again, radical approach is required. We may have to do her surgery, remove the uterus, remove the ovaries, and just treat the patient of her menstrual symptoms. So the crux is that at any stage patient can have irregular periods. The only thing is we have to take the history in detail, we have to talk to the patient in detail, we have to find out, go to the root cause of the problem, whether this irregular period is due to stress of pandemic these days, or it is due to some pathological problem. Once we think that it is due to some pathological problem, please don't ignore it. Immediately get the scan done. Never hesitate to go to your gynec. I always tell in my videos that all of you should have one gynec with whom you can approach at any time, who's just one phone call away. You can approach and discuss your problems. Never feel shy to go to your gynec. Never feel shy to get your internal checkup done. Get your pap smear done. It could be some malignancy lurking somewhere, which can be, if diagnosed in time, can treat you. So guys, take home messages. Take your body very seriously, take your periods very seriously, take yourself very seriously. Never ignore the warning symptoms which your body is giving. And always consult your gynecologist at the first suspicion that your body is telling you that there could be something wrong. Thank you very much. I hope you enjoyed this video. Thanks a lot.